Hi, my name is Janet Laban. I'm a nurse practitioner. I work at the Findlay Hospital Cardiology Department. And I'm going to discuss today some things on atrial fibrillation. So atrial fibrillation, receiving this kind of diagnosis certainly can come with a lot of fear, anxiety, questions, not only for the person diagnosed, but the family members, the loved ones, the caretakers are also affected by this. Atrial fibrillation is the most common rhythm disturbance we see in healthcare. The prevalence is expected to double in the next 5 to 10 years, so it is very prevalent. It is a chronic condition. It is not curable. It changes over time. It's unpredictable. It's chaotic, disorderly, disorganized rhythm that causes the heart to beat irregular, fast, or slow. As far as the symptoms and the presentation of atrial fibrillation, it varies widely. It can be anywhere from absolutely no symptoms at all to quite debilitating symptoms. You know, I've heard people say, I can't breathe. It feels like my chest is or my heart is gonna pound out of my chest. I feel like I'm gonna die. I mean, so it can be some pretty profound, symptoms. Those kind of symptoms will take a person to the emergency room. Other times symptoms are subtle. A person say, I'm, just more tired, or I'm weak, I'm dizzy, a little more short of breath, I have a little occasional fluttering in my heart. And sometimes those subtle symptoms can be easily explained away, until they occur again. There is that, the more AFib you have, the more you will have, another important thing I think is no two AFibs are alike. Oftentimes we want to kind of compare and but treatment is very individualized, and the treatment varies and often will change over time. It can affect anyone. We've seen it in the younger, healthy individual, to the older person who has chronic coronary artery disease, other health underlying chronic illnesses. Certainly the most common people we do see it in are the older person, the people who do have underlying coronary artery disease. Other common chronic health issues that have been identified with atrial fibrillation: obesity, sleep apnea, alcohol or stimulant use, thyroid problems, hypertension, inflammation. And oftentimes, when you read about atrial fibrillation, stress and anxiety are not really listed as common factors. However, I believe they play a big role, and at the very least cause symptoms that may be worse, to worsen. Most of the time when someone's diagnosed with atrial fibrillation, at least one of those risk factors are there. However, there are times that we just don't know. Sometimes we just don't know. Stroke is the biggest risk and concern. Stroke is related to the uncoordinated, the disorganized contraction of the blood vessels that pool, that can form a clot, break off into the bloodstream, access an artery that goes to the brain. So definitely treatment, is aimed at identifying those that are greatest risk for stroke, and typically then blood thinners are what are recommended, and those medicines are lifetime, unless there would be a compelling reason that we would need to stop them for whatever reason. Common treatment with all AFib people is controlling the heart rate. We do that with medication, and oftentimes that medication is for an indefinite period of time. So optimally, restoring a normal rhythm is what we like to achieve, and we can do that by electric shock or Sometimes ablation, by destroying the tissue that causes the arrhythmia. Not everyone is a candidate for some of those therapies, and they are not always a magic bullet. And I think that's an important thing to remember too, that we got to remember that the disease is not curable, but when these treatments are effective, it definitely improves symptoms, improves quality of life, hopefully for an extended, unlimited period of time. What we do may or may not contribute to the chaos of the disease, because sometimes people, feel like it was something that they did. Oftentimes we have ways that we can improve our health, we can clean things up. But sometimes, it happens despite our best efforts. Once diagnosed with AFib, you can't change it. But we certainly can learn how to cope with the uncertainty of it, be hopeful in the current therapies and the evolving therapies. I think it's important to take an honest look at, again, those things that we can change, and have the courage to step out of what might seem comfortable right now before becoming really, really uncomfortable. So believe in your own power that you can and that we can contribute to the calming of the heart.